If your elderly parent suddenly refuses their favorite meals, sleeps more than 12 hours a day, or seems confused about familiar places, these could be subtle signals their body is preparing for its final journey. Most families miss these signs until it's too late. Every year, millions of adult children watch their aging parents decline without understanding what these changes mean. They blame it on old age, dismiss it as normal forgetfulness, or rush them to emergency rooms for symptoms that are actually part of the natural dying process. The truth is, our bodies send clear messages in that final year, messages that have been recognized by hospice professionals and geriatric specialists for decades. These aren't random symptoms. They're patterns, warning signs that appear months before the end. And when you know what to look for, you can shift from panic and confusion to providing the comfort, dignity and peace your loved one deserves in their final chapter. Today, I'll walk you through 8 medically recognized warning signs that often appear in a senior's final year. You'll learn 3 physical changes that signal declining organ function, 2 behavioral shifts families often misinterpret, 2 cognitive warning signs that appear months before the end, and 1 surprising sign that actually brings comfort to families. By the end of this video, you'll know exactly what to watch for and how to provide meaningful support. Stay until the end, because the 8th sign might surprise you and could give you one last precious gift with your loved one. Have you noticed any of these changes? You're not alone. Drop a comment below. Warning sign. One of the earliest indicators that a senior is entering their final year is dramatic, unexplained weight loss combined with a sudden change in appetite. Your mum, who always loved Sunday pot roast, now pushes her plate away after 2 bites. Your dad, who never missed breakfast, suddenly has no interest in food at all. This isn't stubbornness or depression, though many families initially interpret it that way. This is the body's metabolism naturally slowing down as organs begin to function less efficiently. The digestive system weakens, and energy that once went toward breaking down food is now redirected to keeping the heart, lungs, and brain functioning. What you'll notice is that favorite foods no longer appeal to them. Meals that once brought joy now seem like a chore. They might eat only a few spoonfuls of soup or refuse food entirely for days. Some seniors will accept only liquids or soft foods. Others lose interest in eating altogether. The weight loss can be dramatic, sometimes 20 to 30 pounds over several months. Their clothes hang loose, their face becomes gaunt. Family members often panic and try to force-feed them, but this actually causes more distress than comfort. Here's what hospice professionals want you to understand. This loss of appetite is not your fault, and it's not neglect. It's the body's natural way of shutting down. Forcing food when the body can no longer process it properly can cause nausea, vomiting, and discomfort. Instead, offer small portions of comfort foods they've always loved. Don't make eating a battle. Focus on hydration with ice chips, small sips of water, or moistening their mouth with a damp cloth. Let them guide you. If they want a bite of chocolate cake, give them that joy without worrying about nutrition. At this stage, comfort matters more than calories. The most important thing you can do is sit with them during meal times, share stories, and make the experience about connection rather than consumption. Have you watched your loved ones stop enjoying meals they once cherished? Share your experience below, because other families are going through this exact same struggle right now. Warning sign 2. The second warning sign that often appears in a senior's final year is extreme fatigue and dramatically increased sleeping. If your parent is now sleeping 16 to 20 hours a day, struggles to stay awake during conversations, or can barely keep their eyes open during activities they once enjoyed, their body is conserving every bit of energy for vital functions. This isn't laziness, boredom, or even depression, though it can look similar. This is a physiological response to declining organ function. As circulation decreases and oxygen delivery to tissues becomes less efficient, the body naturally prioritizes rest. Energy levels wane significantly because the heart is working harder to pump blood. The lungs are less efficient at oxygen exchange, and cellular metabolism is slowing down. What you'll observe is that your once active parent who gardened every morning or walked around the neighborhood now can't stay awake past noon. They'll doze off mid-sentence. They'll sleep through visits from grandchildren. You might have difficulty waking them for medications or meals. When they are awake, it's only for brief windows of 10 or 20 minutes before exhaustion pulls them back under. These alert moments become precious and rare. Many family members feel hurt, thinking their loved one doesn't want to see them or has given up. But the truth is, this sleeping isn't a choice. It's the body's way of shutting down non-essential functions and redirecting all available energy to the heart, lungs, and brain. During this phase, you might notice their sleep isn't peaceful. They may move restlessly, make small sounds, or seem to be dreaming intensely. Some seniors will have brief bursts of alertness where they seem more like themselves, followed by immediate return to deep sleep. What families should do during this stage is adjust their expectations and visiting schedules. Don't try to force wakefulness or feel rejected when they sleep through your visit. Instead, use their brief alert moments for meaningful connection. Hold their hand, play their favorite music softly, or simply sit beside them. Your presence matters even when they're sleeping. Many hospice workers report that hearing is one of the last senses to fade, so speak to them gently, tell them you love them, and share comforting words even when their eyes are closed. Is your loved one sleeping most of the day now? Let us know in the comments what you're experiencing. Warning sign 3. The third warning sign is one that breaks many families' hearts. Social withdrawal and loss of interest in the people, activities and hobbies that once defined your loved one's life. Your mother, who never missed church, now refuses to go. Your father, who played cards with his buddies every Thursday, suddenly cancels without explanation. They stop asking about grandchildren's soccer games, don't answer phone calls from old friends, and seem emotionally distant even when you're sitting right beside them. This withdrawal is often misunderstood as depression or resentment, but it's actually a natural psychological preparation for death. Hospice experts recognize this pattern as the body and mind creating what some call a protective bubble. As seniors enter their final year, many turn inward. They spend more time in reflection, thinking about their life, dwelling on memories and mentally preparing for what's coming. You might notice them talking more about the past than the present. They'll reminisce about their childhood, their wedding day, or loved ones who have already passed. Some will bring up old regrets or seem preoccupied with unfinished business. This inward focus means external relationships naturally fade in importance. They're not rejecting you. They're shifting their emotional energy toward an internal process that we, the living, can't fully access or understand. Practically, this looks like cancelling regular activities, declining invitations to family gatherings, not returning phone calls, or appearing distracted and preoccupied during conversations. They might ask you to leave earlier than usual during visits, or show little reaction to news that would have once excited them. Some seniors will specifically request fewer visitors or want only one or two particular people present. Others will talk increasingly about deceased relatives as if they're still alive or nearby. This isn't necessarily confusion. It's a bridge between the world they're leaving and whatever they sense is coming next. How should families respond? Respect their need for quiet and solitude without taking it personally. Offer gentle presence without demanding engagement. Don't force them to participate in activities that now feel overwhelming. If they want to talk about the past or about people who have died, join them in those conversations rather than correcting them or redirecting to the present. These final months are their journey, and your role is to walk alongside them, not to pull them back to a world they're naturally leaving. Have you noticed your parent withdrawing from activities they once loved? Tell us what happened in the comments. Warning sign 4. The fourth warning sign affects the mind, and it's one of the most distressing changes for families to witness. Cognitive decline, confusion, disorientation, and memory loss that accelerates rapidly in the final year. Even seniors who never had dementia or Alzheimer's can suddenly forget family members' names, lose track of time and place, ask the same questions repeatedly, or become completely disoriented in their own home. This isn't a new disease. It's the result of reduced oxygen and blood flow to the brain as the cardiovascular system weakens. The brain requires enormous amounts of oxygen and glucose to function properly, and when circulation decreases, cognitive abilities decline. What makes this particularly heartbreaking is how quickly it can progress. Your parent, who was sharp and mentally clear just months ago now, doesn't recognize their own bedroom, forgets they've eaten breakfast, or can't remember what year it is. They might call you by a sibling's name, confuse you with someone from their past, or repeatedly ask when their long-deceased parent is coming to visit. Time becomes fluid for them. They might think they're in their childhood home, or believe they need to go to work at a job they retired from decades ago. Some will exhibit repetitive behaviours like pulling at bed sheets, picking at their clothes, or asking the same question every few minutes, regardless of how many times you answer. Their attention span shortens dramatically. They can't follow television shows they once loved or read more than a sentence or two before losing focus. Conversations become difficult because they lose the thread mid-sentence or respond to something you said 10 minutes ago as if you just said it. Day and night reverse. They'll be wide awake at 3 a.m, agitated and confused about where they are. What families need to understand is that this confusion, while painful to watch, is often not distressing for the senior themselves. They're not aware of what they've forgotten. Many hospice professionals report that seniors in this state often seem calm and sometimes even comforted by the altered reality they're experiencing. Vision-like experiences become common. They might describe seeing deceased relatives in the room, talking to people who aren't there, or reaching toward something invisible. These aren't hallucinations in the frightening sense. They're part of the brain's natural transition process and often bring peace to the dying person. How should you respond? Correct them gently if it matters for their safety, but often the kindest approach is to simply enter their reality. If they think they're waiting for their mother, don't argue that their mother died 40 years ago. Instead, ask them about their mother, or gently redirect. Your goal is to reduce their stress, not to force them back into a reality their brain can no longer reliably process. Has your loved one become more confused lately? Drop a comment, because you're not alone in this experience. Warning sign 5. The fifth warning sign is one that leaves seniors increasingly vulnerable and signals the immune system is failing. Frequent infections and dramatically slowed healing. A senior who rarely got sick now catches every cold that goes around. They develop urinary tract infections repeatedly. A small cut or scratch that should heal in a week takes a month and still looks raw. They run low-grade fevers that won't break. They develop pneumonia after what started as just a mild cough. This pattern of recurring infections and poor wound healing is one of the clearest physical indicators that the body's defense systems are shutting down. As the body conserves energy for vital organs like the heart and brain, the immune system receives fewer and fewer resources to fight off bacteria, viruses, and other invaders. White blood cell production decreases. The inflammatory response weakens. Tissues don't regenerate as quickly. Circulation problems mean that healing nutrients and oxygen can't reach wounds effectively. What makes this particularly dangerous for elderly individuals is that infections present differently than they do in younger people. While a young person with a UTI might have burning, painful urination, an elderly person's first symptom is often sudden confusion or increased fatigue. They might not have a fever at all, or they might develop what doctors call failure to thrive, a vague decline that's hard to pinpoint until blood work reveals an underlying infection. Respiratory infections are especially common and serious in the final year. The lungs become less efficient, the cough reflex weakens, and the senior can't clear mucus effectively, creating a perfect environment for bacterial pneumonia. Even with antibiotics, infections that would have cleared quickly a few years ago now linger for weeks or recur within days of finishing treatment. Wounds, bed sores, and skin breakdown also become major concerns. Pressure sores can develop rapidly in seniors who are bedridden or sitting for long periods. Once formed, these wounds heal incredibly slowly because poor circulation can't deliver the nutrients needed for tissue repair. Even minor injuries like a scraped elbow or a blister can become infected and take weeks to close. What should families watch for? Pay attention to subtle changes. If your normally oriented parent suddenly seems confused, check for infection before assuming it's cognitive decline. Monitor skin carefully for any redness, warmth or breakdown, especially on bony areas like heels, hips and tailbone. Report fevers, changes in urine colour or odour, new coughs or increased fatigue to healthcare providers immediately. Understand that at this stage the goal shifts from aggressive treatment to comfort. Some families choose to treat infections with antibiotics if they cause discomfort, while others focus on symptom management rather than prolonging a difficult final chapter. There's no right answer, only what aligns with your loved one's wishes and values. Has your parent been getting sick more often than usual? Share what you've noticed below to help others recognize this pattern. Warning sign 6. The sixth warning sign is one of the most visible physical changes families notice, and it can be alarming if you don't understand what's happening. Dramatic changes in skin color and temperature throughout the body. When you hold your parent's hand and it feels ice cold even though the room is warm. When their feet and legs develop a bluish or greyish tint, or when you notice strange purple mottled patches on their knees and arms, these are signs that circulation is decreasing and blood flow is being redirected away from the extremities toward the vital organs. This happens because the heart is weakening and can no longer pump blood efficiently throughout the entire body. In the final year, and especially in the final weeks of life, the cardiovascular system begins to prioritize. Blood flow to the skin, hands, feet, arms and legs decreases dramatically as the body focuses its limited resources on keeping the brain, heart, lungs and kidneys functioning. This redirection creates visible and tactile changes that families often find distressing. When you touch your loved one's hands, arms, feet or legs, they feel noticeably cold compared to their torso. The skin may look pale at first, then progress to a dusky blue or purple colour, particularly in the nail beds, fingertips and toes. This discoloration is called cyanosis, and it indicates that blood isn't carrying enough oxygen to those tissues. As circulation continues to decline, you might notice something called mottling, which looks like purple or dark reddish-blue patches that appear in irregular patterns, almost like marble. Mottling typically appears first on the knees, feet and hands, then can spread up the legs and arms. When mottling appears on the knees specifically, hospice professionals recognize this as a strong indicator that death is approaching, often within days or even hours. The skin might also take on a waxy or translucent appearance, looking almost see-through in some areas. Some seniors develop a greyish pallor across their entire face and body. Lips that were once pink become pale or bluish. The overall appearance is one of fading colour, as if the vibrancy is literally draining away. What's important for families to understand is that while these changes look alarming, they are typically painless for the person experiencing them. They might not even notice that their hands are cold or that their skin colour has changed. This is a natural, expected part of the dying process, not something that requires emergency intervention. What can you do to help? Keep them warm with blankets, but avoid electric heating pads or heated blankets, which can cause burns on skin with poor circulation. Focus on their torso and core body temperature rather than trying to warm their extremities. The coldness in the hands and feet won't respond to warming because it's caused by internal circulatory failure, not external temperature. Most importantly, don't let these physical changes prevent you from touching your loved one. Continue to hold their hand, stroke their arm, or gently touch their face even if their skin feels cold or looks discoloured. Physical touch remains comforting even as the body shuts down. Did you notice these skin changes in your loved one? Let us know in the comments what you experienced. Warning sign 7. The 7th warning sign is one of the most distressing for families to witness, though medical professionals assure us it's not painful for the dying person. Dramatic breathing changes, including long pauses, irregular patterns, shallow breaths, and a sound called the death rattle. If you've noticed your loved one taking several breaths, then stopping for 10, 20, or even 30 seconds before breathing again, or if you hear a wet, gurgling sound with each breath that sounds like they're drowning, these are signs that the respiratory system is failing and death is likely very close. Normal breathing is rhythmic and regular, something we never think about because our brain's respiratory centre controls it automatically. But as organ systems shut down in the final weeks and days of life, breathing becomes erratic and inefficient. You'll notice several distinct patterns. One is called Cheney-Stokes breathing, where the person takes rapid, increasingly deep breaths, followed by a gradual decrease in breathing, then a complete pause that can last 15 to 30 seconds. Just when you think they've stopped breathing entirely, they suddenly gasp, and the cycle starts again. This pattern can continue for hours or even days. It's caused by reduced blood flow to the brain stem, which controls breathing. Another pattern is simply irregular, shallow breathing with no predictable rhythm. They might take 3 quick breaths, pause for 5 seconds, take 1 deep breath, pause for 20 seconds, and so on. The pauses, called apnea, become longer and more frequent as death approaches. Each time there's a long pause, family members hold their own breath, wondering if this is the final one. It's emotionally exhausting. But the sound that disturbs families most is what's medically known as a death rattle. This is a wet, rattling, gurgling sound that occurs with each inhale and exhale. It happens because fluid and mucus collect in the throat and upper airways, and the person has become too weak to cough or swallow to clear it. The muscles that normally keep the airway clear relax, and secretions pool there, creating the rattling noise as air moves past them. It sounds terrible, like the person is choking or suffocating, and families often panic and want to do something, anything, to make it stop. Here's what hospice professionals want you to know. The death rattle, while extremely difficult for loved ones to hear, does not cause pain or discomfort to the dying person. They are typically unconscious or semi-conscious at this point and are not aware of the sound or sensation. It's much harder on you, the caregiver, than it is on them. The medical reality is that trying to suction out the secretions usually doesn't help and can actually cause more distress to the patient. What can you do instead? Elevate their head slightly with pillows, which can sometimes reduce the noise. Turn them gently to their side, which may help fluid drain. Use a cool, damp cloth on their forehead for comfort, but most importantly, stay present. Hold their hand. Speak to them softly. Tell them it's okay to let go. Your calm, loving presence is the greatest comfort you can provide in those final hours. Were you prepared for these breathing changes when they happened? Share your story in the comments to help others who are facing this right now. Narrator: Char 01. Warning sign 8. The 8th and final warning sign is one that often catches families completely off guard and can actually bring unexpected peace and closure. A sudden burst of energy known as the rally or terminal lucidity. Days or even just hours before death, after weeks of decline, confusion and withdrawal, your loved one suddenly sits up, seems clear-minded, asks for food, has completely coherent conversations, or requests to see specific family members. It's as if they've returned to being themselves again, and families often interpret this as a sign of recovery, thinking the worst has passed, and their loved one is finally getting better. But hospice professionals recognize this energy surge as one of the final signs before death, sometimes occurring in the last 24 to 48 hours of life. What you might witness during a rally is truly remarkable and sometimes feels almost miraculous. Your mother, who hasn't spoken clearly in days, suddenly engages in meaningful conversation, asking about grandchildren by name and offering advice. Your father, who refused food all week, suddenly requests his favourite meal and eats with appetite. A parent who was confused and disoriented becomes lucid, recognizes everyone, and speaks about their life with clarity and insight. Some seniors use this window to tell family members they love them, to offer forgiveness, to share final wishes, or to say goodbye. Others seem to have a sudden awareness that death is near and express readiness or peace about what's coming. The rally can last anywhere from a few minutes to several hours, rarely a full day. The medical explanation is that the body releases stored reserves of energy in a final surge. It's the system's last effort, drawing on whatever resources remain. But why this happens and why it's so common remains somewhat mysterious to medical science. What's documented is that it occurs frequently enough that experienced hospice workers expect it and prepare families for it. Why does this sign bring comfort? Because it gives families one last precious opportunity for connection, closure, and meaningful goodbyes. After weeks of watching someone fade, confused and distant, this brief return feels like an incredible gift. Families report these final lucid moments as some of their most treasured memories, a chance to hear "I love you" one more time, to have their parent truly present for a final conversation, to laugh together, or to simply sit in comfortable companionship. The crucial message for families is this: do not mistake the rally for recovery. As counterintuitive as it seems, this sudden improvement is often a signal that death is very near, not that your loved one is getting better. Use this time wisely. Don't waste it running to call distant relatives or stepping away. Stay present. Say what needs to be said. Share love. Create a final memory. Let them know it's okay to let go when they're ready. Some families who aren't aware of this phenomenon get their hopes up during the rally, only to be devastated when their loved one passes shortly afterward. But when you understand what's happening, you can approach these precious hours with gratitude rather than false hope, making the most of an unexpected gift. Did your loved one have a sudden rally before passing? These stories are powerful and help other families prepare. Please share your experience below. Elderly mother, CHAR02, on screen. Is that my little one? Tell her I love her. Adult child, CHAR04, on screen. We're here, Mum. We're right here. We love you. Beyond these 8 major warning signs, there are several other physical indicators that appear in the final weeks and days of life that families should be aware of. Urinary changes become significant as the kidneys begin to fail. You might notice that your loved one produces much less urine than normal, and what they do produce is very dark, concentrated, and has a strong odour. In the final days, urine output may stop completely, a condition called anuria. This happens because the kidneys are no longer filtering waste effectively, and it's a clear sign that organ systems are shutting down. Similarly, loss of bowel and bladder control often occurs as the muscles that control these functions relax and weaken. Your loved one may need full-time incontinence care with adult diapers and frequent changes. This loss of control is not something they can prevent, and it's important to maintain their dignity during care. Eye changes are also common and can be unsettling if you're not expecting them. The eyes may appear glassy, teary or unfocused, staring off into the distance without seeming to register what they're looking at. In the final hours, the eyes are often half open, even during sleep, and the person may not blink normally. This doesn't mean they're uncomfortable, it's simply that the muscles controlling the eyelids weaken. You might also notice that if you check their pulse, it's weak, thready, or irregular. The radial pulse at the wrist may be difficult or impossible to find because blood pressure has dropped so low. Body temperature regulation fails, so they might feel hot to the touch at times and cold at others, or different parts of the body might be different temperatures. These signs, combined with the 8 major warning signs discussed earlier, paint a complete picture of the body's natural shutdown process in the final year and final days of life. Of these 8 warning signs, from appetite loss and extreme fatigue to cognitive decline, frequent infections, skin changes, breathing irregularities, and that final unexpected energy surge are your body's natural way of preparing for life's final chapter. Recognizing them isn't about giving up hope or accepting defeat. It's about shifting from curative care to comfort care, from fighting against the inevitable to embracing the time you have left with wisdom, presence, and love. When you understand these patterns, you can make informed decisions about medical interventions. Focus on quality time rather than aggressive treatments that may only prolong suffering, and provide the dignity, comfort and peace your loved one deserves during their transition. Every person's journey is unique. Not everyone will show all these signs, and the timeline varies greatly from person to person. What matters most isn't predicting the exact moment, but being present for the journey, offering comfort, speaking words of love, and honoring their wishes. If this video helped you understand what to expect during your loved one's final year, please hit that like button and share it with someone who's caring for an aging parent. This information could bring them much-needed clarity during one of life's most difficult seasons. Leave a comment below telling us how you're supporting your loved one or what signs you've noticed, because this community is here for you, and your story might be exactly what another family needs to hear today.